Okay. All right. So for those of you who don't know me, my name is Linda Schellenberg. Welcome to any new families who are joining us. We've also invited brokers as well so that everybody is on the same page. The main topic of this meeting is EVV, or electronic visit verification. I just made an announcement just to remind people about the COVID-19 precautions that are still in place. We will be having a staff specific training on Monday, at this coming Monday, the 7th, the 7th at noon, where we will be going over with staff how to use the mobile application. It's very similar to what they're doing now, but we'll be just going over it in detail with actually using the app in real time and going through each of the steps that need to be taken. If you do not want staff to utilize the mobile app and prefer to use telephony, which I will talk to in the presentation, they do not have to attend the meeting on Monday. Let me know so that I can schedule it. So far, I've only had one person reach out requesting the telephony, but that might change today. So just email me after the meeting if you have a staff that wants, that you'd prefer staff to use telephony, and we'll schedule that for next week. Okay, so let's get right into it. So again, if you'll just give me a chance to go through the PowerPoint, certainly use the chat if you have questions. I did include in the chat the PowerPoint and a handout that Vero provided. So yeah, just use the chat if you have questions, and then as soon as I'm done going through the presentation, I'll absolutely get to all your questions. Okay, so let's start the slideshow here. Okay, so the agenda for today, hold on one second, let me just make sure. Okay, the agenda for today is we're talking about electronic visit verification. I'm going to review the 21st Century Cures Act and what EVV means. I'm going to review the options that Vero has in their system to be able to meet the EVV requirements. And I'm going to talk about next steps. I've also put in the slides a bunch of questions and answers that were received back from the Department of Health EVV mailbox, as well as questions and answers from many of you who have reached out, as well as other families that we've heard that are more common questions and answers. So we'll end with that. And then, of course, we'll finish with any questions that are still unanswered that you have. Okay. I know there's been a lot of discussion around EVV, and hopefully this will clear up some confusion or dispel some myths today. So the 21st Century Cures Act is a federal law. It was passed by Congress in 2016, and it is requiring all state Medicaid programs to implement EVV systems for personal care and home health care services. And yes, OPWDD services, community habilitation and respite do fall under that umbrella. All states are required to implement an EVV system to avoid a reduction in federal Medicaid funding. So you know, when we bill Medicaid, there's a portion that comes from the federal government. And states must require EVV use for all personal care services by January 1st of 2020. This should be 2021. And home health by January 1st of 2023. Well, I think it was 2020, and they were given an extension to January 1st of 2021. Okay. So the next slide. So what is EVV? So EVV is electronic visit verification. So it's a system that may include multiple point of care verification technologies, such as telephony, telephonic, the use of the telephone, mobile, which would be the mobile device, and web-based verification inputs. So the key word here is electronic. So previously we might verify a visit by having a staff fill out a paper timesheet, or they might go in and enter it into Vero after the fact. So it would be basically a manual entry rather than a system electronically verifying what the staff is indicating. Okay, so the system electronically verifies the occurrence of home or community-based services. It identifies the time that the service began and ends, to ensure accurate claim disbursement and safeguards that beneficiaries who are authorized get the expected care. So again, this is straight from the state and federal guidance. Okay, so their goal is to verify visits in real time, including the date, the location, the type of service, the individual providing the service, so the staff, and the individual receiving the service, so the individual supported, and the duration of the service, so how long that service took place. It validates hours of work. It's supposed to eliminate billing data entry mistakes, reduced costs related to paper billing and payroll, and help to combat fraud, waste, and abuse. Okay. The goal of EVV is to ensure timely service delivery for members, including real-time service gap reporting, reduce administrative burdens associated with paper timesheet processing, and generate cost savings from the prevention of fraud, waste, and abuse. It aims to strengthen quality assurance by improving health and welfare through the validation of the delivery of service. So again, this was stated in the prior slide, but there's basically, the system needs to capture 6 data points. It's the type of service, the individual receiving the service, the date of the service, location, individual providing the service, so that would be the staff, and the begin and the end time. So again, capturing these 6 data points in real time using an electronically verified system. Okay, so it is mandatory. I'm sorry, my dates are wrong. It is mandatory as of January 1st, 2021. There was already an extension, so January 1st of 2021 is a hard start date for us to be compliant. As an FI, we have to comply with EVV. This is not an option. There's been a lot of information out there that, you know, why are the agencies doing this? And so it is something that we are required to comply with. The good news is Vero, which is not to be confused with EVV, Vero is the system that we are already using, is already set up, and most of the 6 elements are already built into their system. More good news is Vero has 3 EVV compliant options. They have the use of the mobile app, which has already been in existence, and they have recently added, for this purpose, telephony option, which I'll go over, and a fob option, which is a fixed object device, which I'll go over as well. Some other organizations and some other systems might only offer one of the 3. Right? So if an organization has a system and they only have mobile, then yes, then that's what's going to be required to be utilized. But the system that we are using has 3 different options. Okay, so again, these are the 3 choices: the mobile app, the telephony, and the fob. And this is a picture of what a fob device might look like. Okay, so the mobile app. So Vero, we've been using, most of the staff are currently utilizing the mobile app at this time and are, you know, familiar with it. So that's a positive. From the user perspective, nothing really changes. They're going to use the app in pretty much the same way they're using it. They're going to continue to document for services. However, the one change that will be required come January 1st is that they will need to enable location service on the device that they're using so that the mobile app can pick up that location from where they start and where they end. I've included in this PowerPoint, and again, for you guys, I'm not going to go into too much of the detail because we're going to do that on Monday with the staff. And of course, I'll record that and you can review it. But basically, again, there was a lot of misinformation about GPS. So if the option that you're using is the mobile app, well, the way that a mobile app verifies a location is through the use of GPS. So the GPS is going to pinpoint the start of the service and pinpoint the end of the service. Okay, and there is how to turn on location services. There's some support guides. I've listed the link here for Apple and for Android. Okay, so what happens when location services are not turned on? So again, in order to meet the EVV requirements on the mobile app, so if a person is using a mobile app, the mobile app requires, in order to electronically verify the location on the mobile app, they have to enable location. So at a minimum, the user will need to enable the location while using the app. So for those of you who have, and I've done this myself, if you have an Apple, which I have, it gives you certain options to be able to turn on location services. So a person would need to go into their settings and say, you know, if they want to use the the location service at all times, or only when in Vero, or never. So like I had mine on never, so I went in and I changed it to while using the app. So that's the minimum location setting that needs to be turned on for Apple. It might be slightly different on the Android. And again, on the previous slide, I have the Android support link here that can, and we'll go over that with the staff as well, how to turn the location settings on. If the location services are not enabled on the device, the user will receive a warning message. So it will state, so what we're going to do, because this is required as of January 1st. So what we're going to do is in the middle of December, we're going to turn on the location service, the location requirement in Vero, so that when staff start to use the mobile app, they will see a warning. So this is to get them used to and work out the kinks, right, so that they know how to turn their location settings on. They'll get a warning, but they'll still be able to proceed with their service. But come January 1st, they will not be able to proceed. They'll be blocked from proceeding because, again, the EVV requirement is if you're using the mobile app, that location needs to be captured. And when you're using a mobile device, the location is by GPS. Okay, here's another area that some people are getting a little confused with, and I know I was confused with, so hopefully this clears things up. So geolocation is what we're using here. So geolocation is by turning on and allowing the location service on the device. The system is pinging the location when the staff is punching in and when they're punching out, or when they're starting the session rather, and when they're ending the session. Those are the only two data points that the system is pulling. Geofencing is where we would go into Vero and we would plug in an address, and we would only allow the staff to start the session from within that specific location range. So it might be like a, let's say like a quarter mile around that particular address, and if they are outside of that range, they would not be able to start and stop the session. Geo tracking is something like Uber, right, where it tracks the whole time and it pings locations the entire duration of the session. We are not using geo tracking and we are not using geofencing. The only thing we are using here is the geolocation of the beginning of the session and the end of the session. So it's only going to ping the location when they start and when they stop. And after they start the session, they can totally close out the app, and that's fine. And they can log back in when they go to end the session. And again, it's only going to be grabbing the data for those two moments. Okay, so I have more questions and answers about the about this at the end, but that sort of summarizes the major points and a lot of anxiety that people are having about, well, I'm being tracked, and I just want to dispel that myth that there is no tracking happening and we are not using geofencing. Okay, so the second option is, hold on, let me see. Again, if you do have a question, just throw that in the chat, although I'm not seeing it on my screen. Okay. The next area is the telephony. So again, if this is for the situation where a person is not, I think of this as, let's say you have a staff person who doesn't have a mobile device, maybe.
Linda, sorry, can I interrupt really quickly,
Yep.
just because a real quick question. You just said that they have to close out the app in order to stop the geographic tracking. Is that right?
No, they do not have to. So we're not using geo tracking at all.
Okay, so
there is no tracking.
So if they keep the app open, it's only going to identify their location when they sign in and sign out.
Yep.
There's no further burden on them to turn off the app or close the app.
Correct.
Okay.
Now they might see, like in the settings, it does, like for Apple, it will say you know, only use when, let me just look at the language here, only use, turn on the location while using the app. So if they have the app open, it might show a bar at the top that it looks like that the location is on. What that means is the Apple is ready to pick up a location if needed. So if that causes anxiety, then I would suggest just, you know, just swiping up to get rid of the app, close it out. It's not tracking the location. It's just that the setting is turned on for location to be picked up while using the app. Okay, so again, it's just a suggestion if it's causing somebody some anxiety. They can feel more comfortable if they just turn it off. Okay, so telephony is the use of a landline phone to electronically verify a location. So what we would do here is we would get a phone number from you know, from you. So wherever your home phone number, it cannot be the staff's phone number. It's going to be a landline phone number, hardwired number in your home, and we would enter that into Vero so that that would be a registered number, so that when the staff calls in from that number, that they know it's connected to you. Okay, so that would verify that they are calling from your home, and that's the electronic verification that meets the requirement there. Now, I feel like this option is a good option for folks that are only getting respite services. So let's say you have a staff person who is maybe doesn't have a smartphone, or doesn't want to use the smartphone, and the service is strictly respite, so they don't have there's no goals involved. The use of telephony might be a good option. Okay, so again, if this applies to you, let me know, because I'm going to schedule a separate training for those staff to show them how to use the telephony. And it does require the setup of the phone number, and then what it's going to do is the staff are going to be able to dial in. So if you see on the screen, there's the dial-in number. They do have it available in both English and Spanish. If there are other languages, let me know, and I will give feedback to Vero about other languages. They might be, if there's a number of requests, they might consider development in those areas. So they'll be given a phone number. There will be a sheet that they can print out that will have exactly what you're seeing on the screen. And it will show the phone number. It will show their, again, this is all HIPAA compliant, so it just has the codes of the individual's name that has the code, the plan number, so that it ties back into any goals. This example is for Community Hab. For respite, there would be no goals, so they would just use the number to start the session and then to end the session. But if they had goals, each goal would have a specific number and a code for their staff supports and the response. Okay, so this is what it would look like. There would be something that would be printed out, and that we can just work with you on if it's something that you want to print out at the home, or that you have the staff print out and bring with them, just so that they have it when they're making the call. They have all the numbers that they need in front of them. Okay, so telephony can be utilized for Community Hab, as you can see on the screen, but I feel like it's probably a very simple option for respite. Okay. There was a question about use of a cell phone for telephony. So the response is that for a cell phone can be, if you're making a phone call from a cell phone, you can make a phone call anywhere. So it doesn't meet the requirement of electronic visit verification to verify if you're calling from home, if it can be used anywhere. So that's why there is a requirement for a landline. And the landline, so it has to be one of those hardwired phones. And by the way, there are options for phone services that are free or reduced services for people who have SSI and Medicaid. So if you don't have a landline and this is important to you, you might want to consider getting a landline through like a Lifeline service. Mm-hmm.
I'm sorry to interrupt. That was my question. For us, it's actually a real problem in the Upper West Side in the area we live. I haven't tried this year, but we gave up our landline because there was actually no reliable service at all. We were paying for it and you pick up and there was no dial tone. So we gave up. So that's one of the things that I'm trying to understand. Maybe I'll wait and see if Fob would answer that, but this could be a good option for us, but for that thing.
Yeah, I could, I know that there's Lifeline, but as far as a good reliable one,
that was the problem. It wasn't paying for it. It was just we were paying for it and it didn't work. And it's just an issue with like literally the landlines in this area are falling apart.
Okay. So this is, and I'm sorry that I don't know, for some reason I'm not able to see the chat on my screen.
When you share screen, you can't see it.
So, a follow-up question is, because no one really has landlines anymore, my son has a separate cell phone as his home phone.
Yeah.
Because his CDPAP people use that to call in and call out because it literally costs him $100 extra a month to put a landline in. Mm-hmm. And that doesn't really make any sense. Can that cell phone be used as the home phone?
No, it has to be hardwired in for it to verify.
And what is the basis of your saying that it has to be, that you're referring to the requirement? What requirement, where in the statute are you referring to a requirement of, other than the fact that it's his home? What is the basis why isn't that electronically verified? If it's the home phone that's registered as his home.
Yeah, because that phone could be used anywhere.
But that isn't a basis in a statute. Where's the requirement in the statute?
The requirement is electronic visit verification. So to electronically verify that it's happening from the home, the use of the cell phone.
How is that different? I mean, if it's the home phone number, how, if that's his home phone for contacting him on all different places.
I'm gonna get to this, Carol. I have this as a specific Q&A, and I'll explain more why this decision is made. But yeah, so that is for the telephony, that is a requirement that's in place. So yeah, I'll send more information about the Lifeline if you don't currently have a hardwired phone. If you do have, so in that scenario, if you do have a smartphone that's used as a home phone number, I would encourage you just to use the mobile app.
Well, Linda, I think you need to give us a legal basis for that, claiming that it has to be electronically identified as the home phone and landline tied, because I don't see that anywhere in the statute or any of the requirements. I see the feds wanting to know whether it's home or community. And if the cell phone is tied to the home, I don't see why. There's nowhere that says that home phone has to be a landline, other than maybe Vero telling you that. But using the passive tense. The passive tense doesn't work with legal requirements.
Okay.
Okay,
so the next area is the fob, and the fob is a fixed object. So this is what an example of a fob device might look like. Fob requires some setup. So the goal here is that to have something that would be affixed in the home. So let's say this was affixed on a wall somewhere, and staff would come in. They would hit this little white button on the right side of the device, and it would issue a number. They would jot that number down, and then when they end the session, they would hit that button again, and they would jot that number down. So there would be unique numbers that they would be jotting down. And when they return, this will require them to go to a computer after the fact to enter those numbers in. So they're going to be jotting down the code, and they're going to be jotting down the date and time and the location. And they're going to come back into Vero at a later time. And we would set those parameters to be like within 48 hours to meet that contemporaneous window where they have to enter it right away. And they would enter the codes in, enter the information, and click save, and the system would connect the two and say, okay, yes, this number does equal this date and this time and this location. So that's another electronic way to verify the visit. So the little fob device is also using sort of a GPS technology to communicate back to the system certain data points, and then the staff are entering those codes. Now the limitation with the fob is that you can't enter the services, and it's going to require 2 steps. So meaning they're pressing this button, getting the number, then they're having to go back in after the fact and enter it in, and they're going to have to go back in and also enter in the services. This also has a cost associated. I don't have the quotes for how much this would cost. So I really am not thinking this is going to be high on everybody's list of approaches, because I think the other 2 might solve what we're looking for. However, we're making this available, so if really none of the other 2 options work, this would be something that we could work with you on. Okay, and again, we would do a separate training on this. Okay, so the next step. So if you prefer to use the telephony option, reach out to me today so that we can set up a date and time next week to train staff on this option. If you're interested in the fob, let me know as well so that we can speak, and because this I will have to get a pricing and order those devices so we get them in time before the January 1st deadline. And unless you opt into telephony or fob, then we're going to be training the staff on the use of the mobile app. So as I mentioned, on Monday, I'll be having a live staff training. Be going through step-by-step the use of the app. I'll have the app. I'll be going through each step on the screen. I'll be recording that and sending out information following the meeting with screenshots. So we'll be working with staff to get them comfortable with basically the use of the location services on the app. Other than that, most of the the app is the same. Okay, I'm sorry. Oh, now I see the chat. Okay, hold on. So, and then on December 12th, I'm going to turn those location settings on. But I'm going to have, so that we can be prepared for January 1 and get staff used to the use of the location settings. And they'll get a warning, which would mean that they can still proceed. They'll get a warning that will ask them to turn their location on, but they can still proceed. And then on January 1st, again, staff using the mobile app will not be able to proceed without turning that location setting on. This way we can pull that data from when they start and when they end the location. So let me just pause for a second now that I can see the questions. Okay, so a question is, can we use the web portal after this? Oh, so this is a good question. So yes, staff can use the web portal to enter services. So let me just explain that. The services are what Vero calls the goals. So the goals part of it doesn't have anything to do with Evv. So it's not one of the 6 data points that they have to enter goals. So the services, so if the staff use the mobile app to start and stop the session, and then they go into the web portal after the fact and enter those services, they can do that. I would discourage that because I find that it requires, especially on us here and on you, we end up having to, it slows down our approval process to get the payroll done because we have to reach out to staff and say, you didn't enter services on this date, please go in and enter them. But if you're really on top of it, that's acceptable for them to do that. Okay, another question is, can an individual meet the staff member somewhere other than the home and start the punch-in time where they meet? Absolutely, yes. Services, community hab services can be provided anywhere, respite as well, you know, not anywhere, you know what I'm saying, either home or in the community, not in like certified locations or in the hospitals, but so yes, if a person starts at home and then ends in, you know, at the grocery, at the supermarket, that's fine. In Vero, we already have person's home address. So when the staff go to, let's say they're using the mobile device and they go to start the session, if they're within a certain range of that home address, it's going to just immediately say home. Anywhere else, it's going to define it as community. And that's okay. There's no requirement. We just need to distinguish between the two. Okay. Can telephony be connected to a family member's cell phone? Okay, so I've answered that question. I'm going to give you a little bit more about that. Okay, with CDPAP, they actually only let someone call in from a family member's phone. So yes, I have heard that there are other vendors that are allowing the use of a cell phone as a landline phone. So, you know, I'll get to that. I'm going to talk a little bit more about that. Okay, is telephony an option for ComHab service? Yes, so telephony is a good next option because they can enter their goals as well. They can enter all the services. They'll be given a printout that will have all of the codes that they need to enter the services. So this way they don't have to go back in and make any, they don't have to go back in after the fact to the web to add those services. They could do it totally on the phone. Okay, let's see. Okay, what is the requirement other than home? Okay, so there's been a lot of questions about, well, I'm going to skip this one question because I'm going to get to that in a moment because I'm going to go through some Q&A from DOH. Is it okay for apps to be on a tablet or on a computer? Is it okay for apps to, okay, so an app is on a mobile device, which can be a tablet or a smartphone. Right now, Vero does not have a web option. So many of you know about when you go onto a laptop or a computer, you can also pick up, turn on location services. Vero is looking to develop that option at some point in 2021. So right now, the three options that Vero has is the mobile, which would be a tablet or a smartphone, and the telephony and the fob. The web check-in using the GPS location, that's in development. So that will be something that we can look forward to in the future. Okay, if the staff doesn't want to use the GPS, can the individual do it on their phone? So the staff person is the person that has to enter the services, right? They have to be logging into Vero with their credentials. However, that application can be on the individual or family member's smartphone or tablet. We have some folks that are doing it that way now. I think that's a very good approach because it allows you to track and monitor that staff are doing what they need to do. So that's totally acceptable. Of course, the staff is going to enter their unique username and password, and they're going to be the ones doing the documentation. Okay, can we use a combination of these? Yes, you can use a combination of these. I think that is a very good idea. Okay, so if you want to use the mobile we just have to set it up. So if you're using the mobile and telephony, we just have to set up both so that we have the phone number and you have the codes as well as the use of the mobile device. Okay, so somebody else has, the iPad we use shows a bar on top that says Vero is using location service. Yes, so I think I mentioned earlier that I know on the Apple, and I'm assuming it's probably on the Android as well, when you do the location setting to use whenever I'm in the device, it will show that bar at the top because at any point, if the system wants to pick up that location, it's ready and able to do that. If that makes you uncomfortable, totally close out that app so that there's no question about it. However, I want to make the point again, we are only grabbing the data from at the point in which the staff starts the session and when they end the session. Okay, session means, so there's two different things that happen on the app. There's when staff are starting to use the app, it's punching them in, and that's the employee time. So we're not pinging their location when they punch in. We're just doing it when they get to the part of the app where they're starting the session, which means they're face-to-face with the individual being supported. They click start the session, that's when that location is starting. Okay, what if a staff, so for telehealth, Vero is working with the state so that, in Vero currently, when staff uses telehealth, they do indicate telehealth, so that's good. And the question came up, does that kind of data still need to be sent to the state aggregator? So that they're working on that because they haven't, Department of Health, to my knowledge as of today, hasn't clarified exactly what to do with telehealth. Okay, so the data, the EVV components need to be sent to a state aggregator, which is like a database that that the state of New York set up, and they've actually combined it with their billing system, eMedNI. This is a system that we use to bill for the services. We're going to be sending data, these data elements, to the state aggregator prior to us billing. So we bill every 2 weeks. Right before we send the billing file, we have to send it to the state aggregator to get back an approval in order for us to bill. Okay, so that data, there was some confusion about GPS location, and due to advocacy from a lot of people on the call, there were questions about, like, why do we have to send, if somebody's using the mobile device option and where GPS is utilized to get that location, do we have to send that actual address to the state aggregator? So the state responded that we do not have to send to the state aggregator those data points. We only have to identify home and community. There was a lot of back and forth about this. So at the end of the day, the electronic location verification, if it's using GPS coordinates, we as a provider are required to maintain that location information in our system. So if I go back to this screenshot here, so this information right here on the right, where it has the location, this information we keep in our system, but what we send to the state aggregator would be just community, because in this location, in this example, it was community. So all we're sending to the aggregator is community. But this actual address of where the service started and ended, we maintain in our system as per the Department of Health, because it is an auditable, it could be requested for auditable confirmation. Okay, so then the question is asked in a few different ways. So can a staff person, so then the other question is, well, do I need to use the mobile device? Can my staff go into the web and enter it after the fact, which some staff are doing now? The answer is no, because that's not meeting, backfilling of past visits doesn't meet the requirements of the Cures Act, because the Cures Act is requiring electronic visit verification. So at the time that it happens, on the date it happens, and the location it happens, all those elements have to be verified.
You just say that we could use the portal.
Say it again.
You said that we could use the portal.
The staff that are using the portal?
You said that, you just said that that the staff could use the portal.
Okay, the staff can only use, I'm sorry, Tucker, let me clarify. The staff can only use the portal to enter the services or the goals. So if you think about the 6 elements of EVV, it's the date, it's the time, it's the time in and out, it's the location, it's the provider of service, it's the individual being supported. It's not the specific goals. So when I said the use of the portal, they can use it to enter the goals after the fact. But everything else to meet those 6 elements has to be done in real time in one of these methods. Okay. And again, there's some, there's some other ways that this question was posed to the Department of Health to try to get to the answer. And if you look at the last sentence, so the provider agency must retain and maintain documentation of manual entries for Omig and Department of Health audits. So let's say a staff person forgets to clock in and out, which does happen. They will have to get in touch with us like they do now and say, I need to, right now they're entering it into the portal. They're going to have to get in touch with us to enter it for them. And we'll have to put a reason for that. And that information has to be monitored. The choice model. So this was another question. So New York State is actually taking the most minimally burdensome approach to meet the Cures Act in response to some stakeholders due to privacy. Again, many of you on the call during the initial implementation really spoke very clearly that the use of the GPS and invasion of privacy. So the state is only collecting home and community to meet that requirement in the aggregator. However, we need, although they're not requiring the GPS, we do need to maintain auditable confirmation, including the visit location. So this is where I think a lot of people got confused, is that, yes, we will be collecting that GPS location. We're not sending it to the state aggregator, but we maintain that because upon audit, if it said, how did you verify that this was home? We need to pull up that specific detail that shows the address and that it was collected through the use of GPS method. Okay, here's again is the question again that we're only sending those elements to the state aggregator. And it needs to be electronically verified. Only the start and end time, not the whole time. So if there are systems out there that are using the Geo Tracking, that's not what's being required. It's just the geolocation if use of mobile device. Okay, so here's some other questions I've gotten, some of which we might have discussed already. The question is, the state's documentation and questions addressed to the Department of Health clearly say GPS is not a requirement for the EVV system to capture the required Cures Act data. Are FIs overstepping and adding an additional requirement? So this is my answer. The first part is accurate. If a mobile device, however, so it is true, GPS is not a requirement. However, if a mobile device is the option that is being utilized, then the GPS location is the way to electronically verify that location. Vero has the telephony and the fob option as well. Many staff use and prefer the mobile device and the mobile app for documentation, so using this option makes sense for many people. Okay, the second question is, the Department of Health has indicated that they do not need the locations, that they only need home and community, so why are GPS locations still being required? So again, I went over this, but again, to be in compliance with the Cures Act, we need to electronically verify the location. So if the staff are using the mobile app, we need to maintain the location as evidence that it was electronically verified. Remember, it's called electronic visit verification. In addition, the Department of Health has indicated that this detail is not necessary for the aggregator, however, may be requested upon audit by the Office of the Medicaid Inspector General, and therefore we have to store that data in our system.
And then you don't believe for the people who all are taking the services.
Say it again, Tucker.
You said that you don't believe the people that are taking the services?
Yeah, yeah. You know what? Look, if if we weren't mandated to do this, we wouldn't be doing this. I agree with you. This is, you know, it's burdensome.
And another thing, why you did not add it to the advisory committee?
Oh, this information?
Yeah, because you should allow a know before so we can find it. Because I live independently and I can't, I don't want to be tracked.
Yes. Yes, I know, Tucker, and I agree with you. I want to reinforce that we're not tracking. It's picking up that location where they're starting and stopping. And I know I wouldn't personally, you know, this is not something that I've decided to do to make people's life more difficult. It's a mandate.
A 0.99% of fraud.
Say that again.
There's a 0.99% of fraud, chance of fraud.
I know. There's bigger fish to fry. I know.
You can't pick the people who are cheating the system.
And you know what I have to say? I think there was advocacy spoke volumes in the way that the state handled the aggregator and the information sent to the aggregator. I think we need to continue the only thing I can say to that, Tucker, is we need to continue to advocate on a federal level, because that's really where this is stemming from, is that Cures Act and the requirements there. I agree with you. Okay, so why does Vero not allow the mobile device to be used for the telephony? Okay, so the CMS guidance and in all of the responses we've received from the state indicate that the location must be an auditable location. The use of a cell phone, which cannot be guaranteed to be at a specific location, unlike a landline, does not provide an auditable location. Therefore, it does not meet the requirement fully for EVV. And if we proceed without this, we would be at audit risk. So a landline number is a regular phone number that relies on the physical wires to enable the voice call. And a phone number for a cell phone wouldn't be considered a landline number because it uses the radio waves to transfer the voice call. So I know you don't like this response, Carol.
Yeah, no, but I'm just trying to understand. So basically what you're claiming is that because you're subject to audit, you guys are going to require things that aren't in the statute. And what I'm trying to understand is, where are the additional audit requirements that are new because of the CARES Act and EVV? I don't see anything in the federal audit guidelines or the state audit guidelines that require any capturing of anything. And why is it that big organizations like Chinese American Agency that provide thousands and thousands of people of coverage under the same statute aren't requiring this sort of nonsense?
I'm not sure, but we are, all of us are signing off.
They have lawyers on their staff. Their CEO went to law school. They're not requiring any of this stuff.
Okay.
Why is it that little fish like CFS are saying, oh, we're going to do all these things because our software company tells us we need to, when the big fish aren't requiring it?
It's not,
Linda,
that's not the case.
Linda, in this case, I will feel jealous. CFS is not small fish. I know it's a big organization, and I totally understand. You have to do whatever it requires. Can I ask you, so all of this, I just want to verify for myself, I tried to figure out. I have landline, but I didn't use it long time ago. It's on my name. Do I have to transmit it on Paul's name?
No, you don't.
Okay, so, you know, on a mobile phone, sometimes it's something working on app, sometimes it's not working with this verification. Most of the time, service started from my house. So I didn't use my phone line for a long time ago. It was transferred to something, but I can make it work again. I can make it because I put to my fax machine now. So, you know, I can make it. So for the verification, it's okay that the person who is working with Paul come, make a phone call from this line, whatever it's called, and the rest we'll do later on his apps, because I want to make sure that, you know, somewhere it was captured, you know,
Yes.
whatever you need requirements, it was captured.
And
So
the use of the phone they can capture all of the goals as well. So this way you don't have to go back into the computer. But yes, you could do either way. Let me just,
so
if I
in
can.
this case, it will be, this is what's my question. In this case, for example, if the person did it from the phone, it's automatically went to this system.
Yes, it automatically goes to the system. Yes, that's correct.
It was already, so when she opened her stuff, you know, on her Vera to put goals, whatever it is, what she did, what she didn't do later on, she will see the time, clock in, clock out, yeah?
Yes, that's correct.
Okay, so,
Yeah.
but it's not like mandatory to use only one way all the time.
That's correct. You could use multiple ways.
Okay,
Yeah.
okay, thank you.
Okay, so let me just go through a few more questions that have come up. And yes, we are signing as an FI, and all of the providers of service around the state have to sign an attestation with the Department of Health that is holding us responsible to meet all of the required elements. So we are, as an agency, we are not going to take a risk that is unnecessary to you know, to put us at risk with what we're signing. We sign this attestation, we're going to do the responsible thing. We could say to Vero, yes, we're not going to use any of these features, but we'd have to sign a waiver that says that we are willing to take that risk. So I understand that there are concerns. If there are providers that are doing different things, then they are putting themselves at risk. Okay. There are also providers that are taking a harder approach where they're, you know, they might be using the fencing. They might only be using the GPS location. There's no option for telephony. There's no option for fob. So you know, I hear some of the negative feedback. I understand where it's coming from, but you know, I would just remind you that you know, we're trying to be in compliance. This is a big deal. And if we put ourselves as an organization at risk, that has other implications. Okay, so there was another question about why does Vero not allow the mobile device to be used for the telephony? I think I answered this one. And then why is Vero mobile app not in the App Store? So this was a good question. I did reach out to Vero. What they indicate is they've gone through a rigorous process to be able to host the apps outside of the App Store. When it's in the Apple Store or the Google Play Store, it requires approval. It takes a lot of time. If they're going to be doing updates, they can't get that information out to their customer base in a timely fashion. And going through the developer access allows them a greater control. You would never be advised to trust an app that was developed by an unknown source. The system we're using is a known and recognized entities, fully compliant with HIPAA high-tech requirements. If you want more information on the system security, you can visit their website to review. Okay, so again, if staff, if we do not turn on the location services, which some of you are requesting that we consider doing, we would not be meeting the elements for capturing the location when staff is using the mobile device. We would not be in compliance and would therefore not be able to bill for the service. Why are we using Vero? We've spent many years vetting software solution. Personally, I've spent many years vetting software solutions. I put many of you through years of paper so that we can get a system that had the most comprehensive approach, that was focused on self-direction, that greatly improved our process and workflow. Other vendors, you know, for those of you who know, I am overseeing Community Services Center for Family Support. We use TheraP. TheraP does not have half of the features that Vero has for self-direction, MITC, Foothold, Precision Care. These are the other vendors that are equipped to deal with OPWDD services. They do not have the self-direction solutions that I found were needed. They might address part of it, but it's not a comprehensive approach. Some FIs use one software for service delivery and another to meet the EVV requirement, and we feel that this is an additional step that's less efficient and a less effective approach. So that's why we're using Vero. Okay, and the next question, why do you need to track my child's location? I want to just remind you, we're not using geo tracking. We are not using geofencing. For staff whom use the mobile device, they need to allow the location to capture where they begin their session and where they end their session. And that's in order to meet the location element required by EVV. What if it's not exact? So we all know that GPS can be slightly off. So there is an allowable range, and staff can update the address within the range. So if the location shows as 195 Main Street, but the address is 196 that populates, the address can be corrected as long as it's within that range, and that's fine. And again, if it's community, it's not going to matter. They can check in anywhere that the service is being provided. Okay, so again, when using mobile device, how does the system know home or community? So we have a record of your home address that's defaulted in the system. And if the GPS pings outside of the range of the home address, it's going to be marked as community. Is there an option for the web where staff can use computer or laptop with the location service on? Not at this time, but as I mentioned earlier, I've reached out to Vero to make this suggestion for future updates, and they have indicated that the web is notoriously unreliable, but they're considering this for future development. It's not going to be available on January 1st, but at some point during the upcoming year. Okay, so let me stop sharing here. Okay, let me just go back to the chat and just see, okay. Again, I think that you know me, for those of you who know me, we're not going to do something that we're not required to do. And when I looked at that, attestation that we have to sign for EVV, it is requiring us to meet these elements. So, and I'm looking at the other systems that are available. I feel like this offers a lot of flexibility. I think if you still feel very strongly that this is a problem, I would highly encourage continued advocacy on the federal level, because that's really where this is stemming from. So, yeah. So anyway, I have, I have reached out, Kim, to your question, I have reached out to Vero about being in the App Store, and I think I read the slide to you as to why.
No, I heard it. Thank you.
Okay,
I was just saying, and I really appreciate it. It's just something where when I was explaining it to my worker and trying to figure out, it didn't work, but I think we must have done something wrong the first time. It just made me really nervous because every time I've tried that with something, it's been a bad idea.
Yeah. Yeah, and I did, when I got the question, and I'm glad you guys, continue to send this information to me so that we can get answers to help, with what you're thinking about now. And again, you would never download an app that you didn't know, but because this is a known entity that we're utilizing, it does give them flexibility. And if you noticed with Vero, yes, you might have certain feelings about that they're taking advantage or whatever the case may be, but if you notice, they're very responsive, in my opinion. I don't work for them. They're very responsive when it comes to updates. When COVID hit, we had the ability to get staff to enter, the pre-screening questions, which is a good safety precaution that makes sure staff are being vigilant. In the other system I'm using, we don't have that. In the other system I'm using, we get updates once in a while. With Vero, we get regular updates. Yeah, I'm sure every system is going to have its issues, but my opinion is this one has the most comprehensive approach for self-direction. And I think in the EVV world, most of the staff already using the mobile device. I know that there's been some issues where staff have had trouble, and that's why I'm going to spend time on Monday. So if you have a staff person who is having trouble with the mobile device, with the app, and because there are a bunch of different steps. Every step has a reason, but some of it is not super intuitive. We're going to spend time going through with them so that they understand every step of the app process, because sometimes if you skip something, it doesn't work properly. We'll continue to give Vero feedback on ways that they can make updates that are more intuitive. And yeah, so that's all that I had. Is there any question that is burning on someone's mind that was not in the chat?
Linda, Joe Campagna here. Quick question. I may not have heard your response in the chat, but through another source, I heard that there's a waiver for assistive technology because the state is mandating this, and that people should go to their care manager and ask for that, or
for landline? For a landline?
No, I think it was just to buy an iPad or to buy whatever. I haven't.
Well, I'll look at, yeah, if you can forward to me that would be helpful information to share. What I can say is if in the OTPS, you can utilize OTPS for other goods and services for independents to purchase an iPad if you need. There is phone services also in OTPS. So there was something specifically written in the regulations, like that the technology, if it's needed for the F5 for the self-directed services, then you can use that OTPS to purchase. So absolutely. Okay, there was another question. Can I bring my child on respite stay in grandma house? Okay, yes, respite can be provided at their grandparents' house. That is acceptable. Would they have to be in the life plan if you want to purchase an iPad in OTPS? Yes, there would be something that would indicate a justification in the life plan. It could be in the narrative. And Ken, thank you for that. I just wanted to read it, that CFS is on the lighter end of the EVV policy compared to the dozen of other FIs that I work with, and Ken is working on a comparison. So thank you for that. We do try not to impose anything that is not required. So, okay, so I think I've covered this again. I did put the PowerPoint in the chat. Just remember that I made an error with the date of 2020. It should be 2021, January 1st. I'll be having the training on Monday. I have sent that out to all staff, but please feel free to remind them. And if you'd like to participate, you're more than welcome to as well. And I will record that and share that. I did make some announcements earlier just about COVID and continuing to be vigilant. And I think that's all that I had. So I greatly appreciate your attention. And I forgot to say, I hope you all had a happy Thanksgiving. I will be having a meeting. I haven't had a chance to think of the topic yet, but we will be doing another one in 2 weeks. Jennifer will be slowly returning. She's on the call right now. Jennifer and Faye are here. So if you need any of us, let us know, and be safe. Have a good winter. Until next time.